Hello friends, welcome to my channel. In today's video, we will be learning about acute liver failure. Now, before starting on with the acute liver failure, let's understand what is a liver. Now, think of liver as a chemical factory which produces chemicals in order to maybe process nutrients, filter toxins, and run everything smoothly. Now, what happens is if if this particular factory is shut, is not working anymore, this condition is actually an acute liver failure. It's a rare but a serious medical emergency, and it needs to be treated as soon as possible, and that is what we will discuss in our video today. Now let's understand what a healthy liver is. Now, talking about a healthy liver, the superpower it holds is to do a metabolism regulation. Now think it of like energy manager. So it breaks down carbohydrate, fats, and proteins for energy, converts excess glucose into glycogen for storage, helps maintain normal blood sugar levels. It also has a job of detoxification, as I told earlier, that it does the filtration of toxins and remove all the toxins, drugs, and any of the harmful chemicals from the body. It also breaks down the alcohol and medications. Then it has a job of production of a bile, which is a digestive fluid, and it helps to digest and absorb fat and fat soluble vitamins such as A, D, E, K. Then it also has a job of production of a vital blood protein such as albumin, which maintains the blood volume as well as pressure. It creates clotting factors. Now these clotting factors helps to create a clot and stop the bleeding whenever we are injured. The next part is that it stores vitamins and minerals such as A, D, E, K, B12, and minerals such as iron, copper, and D, and this liver helps release them whenever our body needs it. So that is the job of a healthy liver. So what is an acute liver failure? It is a rapid decline in liver function. So all the functions that we discussed recently, such as filtering toxins, producing essential proteins, all of this, there is a rapid decline. Not only decline, there is a rapid decline in this liver function, and this typically happens in someone without any pre-existing liver disease or living liver conditions. It happens within days and weeks, and it can quickly become life-threatening. So it is definitely considered a medical emergency, and it has to be treated as soon as possible. Now let's discuss the common causes of acute liver failure. So, acute liver failure can be triggered by various several factors, and the major slice, as you can see in this particular pie chart, is often caused by an overdose or a toxic reactions to the medications, especially the acetaminophen, these drugs, and it's actually the most common cause of acute liver failure in North America and UK. The next chunk, as you can see, is via hepatitis virus. It can be A, B, or E and can repeatedly damage liver cells. Now, how this particular hepatitis virus can travel is usually in an unhygienic condition, especially the food and the water is the main cause of getting this hepatitis virus. And there can be several other factors such as metabolic and genetic conditions like Wilson disease, which can disrupt the normal liver function, and it can be an autoimmune disease wherein our own body's immune system can attack the cells of the liver and it can attack it, and other causes such as some toxins from a mushroom named as a death cap mushroom, and then there can be some kind of a heat stroke or some kind of a pregnancy or any unknown factors that can trigger acute liver failure. But the major chunk of the cause is actually a drug overdose, or a drug reaction, kind of an anti-reaction, or it can be due to the hepatitis virus. The main cause is actually those within the major other factors that can cause acute liver failure. Now, not talking about acute liver failure symptoms is actually this happens suddenly and develop quickly. One of the first visible signs is actually a jaundice, which is a yellowish condition of our skin and eyes, and this is due to the bilirubin buildup. Now, what is bilirubin? Is actually a byproduct of processing old and damaged red blood cells in the body, and as a byproduct, bilirubin is uh, built in the body, and the liver processes it. Now, when once the liver is not functioning properly, it can't filter out that bilirubin, and hence the yellowish skin tone of the is seen, as well as the eyes. And many patients also have shared that they have some early symptoms as kind of a abdomen pain. Not only pain, it's also a swelling there due to the fluid retention in the body. And other early symptoms is nausea with vomiting, loss of appetite. And as the condition worsens, this can also lead to confusion and disorientation, and also a slurred speech. Now, why this happens is because the toxins are not being removed from the body, and hence this kind of a situation happens. Also, the patients have reported that they can get drowse easily, and even they bleed easily, because obviously there's not enough clotting factors generated by liver, and hence this can happen. Also, the stool color can be of grayish tone, clay style, not style, clay colored stools. So why this happens is because the bile production is not being done, and that adds color. The bile juice actually adds color to our stool, and hence that is the reason that you can see a clay colored stool. So that is one of the major indications, and it's an urgency. When this confusion, slurred speech, and all these conditions symptoms appear. uh, so that's a quite urgent medical attention that we have to provide to the patients. Now, here is a healthy, fatty, and a cirrhotic, which is actually an acute liver. Now, as you can see in the normal one, it is a smooth surface, and it is having a uniform texture. This is how a liver should look like, and it should function normally, processing toxins, producing proteins, and storing energy efficiently. Now, when we talk about the fatty liver, here the fat accumulates inside the liver cells, making it appear enlarged, as you can see. This can happen due to obesity, diabetes, or an excessive alcohol. And even though this particular condition of fatty liver is reversible, if it is not taken care of, it can progress and can lead to even cirrhotic liver. Then there is a cirrhotic liver, which is actually a damaged one, and it leads to scarring, irregular texture, as you can see, and there is some shrinkage as well, as you can see here. So this is actually a severely damaged liver, and it does not function properly. It is not able to produce chemicals, it is not able to filter out toxins, it is not able to store energy properly, or all the liver functions. It's not doing that properly in cirrhotic conditions, while in normal it is behaving healthy. While in the fatty one, there needs to be some prevention done in order to reverse it to the normal condition. Now, talking about the diagnosis of acute liver failure. So, how do doctors suspect that there is an acute liver failure condition? Is actually done by a liver function test. If they see that the liver enzymes, such as ALT, SLT, these are often really high, along with the bilirubin, which is also elevated, as you know that it's a byproduct of the processing of the red blood cells, old and damaged ones. So if the bilirubin is not being taken care of the liver, it would eventually be more in the blood, right? And then it also checks the coagulation levels, the clotting factors. The key marker is 1.5. It's greater than or equal to 1.5. It's actually a key marker. Along with the ammonia levels, these are also checked for the diagnosis of acute liver failure. Now, apart from all the blood tests, doctors also check for several other important markers, such as viral markers, to see if it is a hepatitis A, B, C, which is the cause, if it is an autoimmune marker, such as SLA, to detect autoimmune hepatitis. Is it to rule out any of the Wilson's disease? They also check for ceruloplasmin, and pregnancy test in women, because pregnancy test can also sometimes trigger liver function failures. So there are various several serious health risks as well. So first is obviously a brain swelling, as we have told that there can be a buildup in the body, and it can also reach out to the brain, and it can cause confusion, disorientation, and stuff. Along with that, we have also discussed about bleeding problems due to the liver not able to make enough clotting factors and clotting proteins. There can be some infections, kidney failure. Now, why kidney failure is because the overall stress on the body has increased, and it has reduced the blood flow, which can eventually jump on the stress over to other functions, other organs such as kidney. It can also have a low blood sugar levels in the body, and it can increase the fluid buildup in the body as well, as we have discussed, such as bilirubin. Then at the really serious health risk is there can be multiple organ failures if the liver function does not recover quickly. Failure of other organs such as brain, kidney, lungs, or can occur, and it can lead to life-threatening situations. Treating acute liver failure starts with an ICU care for constant monitoring and intensive support. The next step is to find and treat the cause. The doctors may try to find out what's the actual cause. Is it a paracetamol poisoning, hepatitis, or an autoimmune hepatitis, and accordingly give the targeted treatment. Then there can be a supportive care. It can be giving some fluids, it can be giving some electrolytes to prevent lower blood sugar levels. It also helps in preventing, the doctors also helps in preventing infections, and they follow a strict hygiene diet along with the hygienic care. Patients also receive nutritional support, and if the liver cannot recover, the only permanent solution is to get a liver transplant done. Lastly, I would like to share my thoughts and why I chose this topic. So, this presentation is dedicated to one of my juniors from my alma mater, who tragically lost her life due to acute liver failure. This news deeply affected me and sparked a strong desire to raise the concern for this particular condition at the best of my abilities, especially how silent and fast it can progress. So, talking about those thoughts that I had is, you do not ignore symptoms such as jaundice or confusion, and these can be a sign of something serious. Limit or eliminate alcohol intake, I would say eliminate, completely eliminate, because even the small habits can have long term effects. You never know. Now, invest in a comprehensive health insurance. This is really important because you might have some kind of a limit to your health insurance, and maybe the spending on this particular treatment could be more than that. Let's say you have 5 lpa, and then the cost to get this transplant done, let's say, is 25 lp. Now, this particular thing should be a good chunk of a health insurance plan should be there, along with it is able to cover the major illnesses such as transplants as well. There should be regular health checkups so that anything can be caught early. Some kind of a you want to spread awareness, to talk to friends, talk to family about importance of living healthy, and I would really request to support organ donation as well as liver transplant programs, as this can offer a second chance to someone in need, really. So thank you for being with me here, and learning about the acute liver failures and some kind of thoughts and some suggestions for how we can live healthy. Thank you so much.